What's going on, ODs? Thank you so much for your interest in working with us at Aspire Health Solutions. I'm Dr. Calderon, and this is I'm back at home base right now, and I want to give you a quick recap of what it is that we're offering. Basically, we're offering the ability to work, change up your day, change up your week, get out of the exam lane, and do a little bit of different type of optometry. We have patients that we have that are homebound mostly, and they need some additional care. So we're bringing back the house call. A lot of the work that we do is house call work, but we are also doing work where we're doing screenings and the patients are coming to us, and there's a lot of different variability. But for the most point, we are going to be on location in some way, shape, or form, and we're also offering the ability to do a lot of work in a short amount of time and get paid a lot in a short amount of time. Most of our doctors are making between 600 and 1,000 plus per day, and they're doing it within the confines of your 8-hour workday, usually 5 and 6 hours a day. So that's really a great way to make a good amount of money in a short amount of time. And we have a lot of contracts. We've been working at this for years in the mobile space. Started in about 2010, so this isn't a new thing for us, but we are getting bigger, so that's why we have this video, and that's why we're talking to you now. So a little bit about what we do, again, is mobile eye care. It's same thing that you would be doing in an exam room, slightly modified for for someone's home or for a screening environment. We do not provide equipment, though. So, but the reality, you have everything you need because we're not doing refractions, so you don't need a phoropter or anything like that. You're just doing basically an anterior seg exam, posterior seg exam, and a history. And for the pressures, that's on you. You can use any kind of tonometer you want. Most people will use like a tonal pen or something, and the reality is you can use whatever you want. The people make back their investment on that tonal pen probably within the first day or two. So it's really not that big a deal, especially when you're making this much money in such a short amount of time. So, that's really a non-issue. But we do need help across the country. Right now, we're looking for these major states. It's Maine, New York, New Jersey, North Carolina, South Carolina, Georgia, Florida, Illinois, Ohio, Colorado, and Texas. If you're not in one of those states and you still want to do this, don't feel bad or timid or anything, because likely we're going to end up getting there to you right now. We'll probably get there as well, but right now, these are what we need. So if you can just put your information right down here, I'm going to make sure that we contact you when we're there, okay? So I already recapped what it is that we're doing. We're doing mobile exams. It might be in the home. It might be somewhere else on location. We'll also do retinal exams with reviewing them versus on an online portal. We'll talk more about that. Telemedicine, basically, but we'll talk about that later. We're doing home exams, and we're making a lot of money in a little bit of time, and we're changing up the pace. So that's what we're up to. So I thank you for your interest. Thank you for listening, and if you could just fill out the form right there, and if you have any more information or any more questions, rather, go to aspirehs.com/OD forms. All right, so the link will be somewhere down here as well. So thank you again for your interest, and we'll talk to you real soon. Later.